Well, good evening and welcome, everyone. Thank you so much for joining us for another wellness webinar series event with Jefferson Health. My name is Sarah Breckbill, and I will be serving as the program facilitator and will present your questions to our experts this evening. Our panel of experts include physicians who specialize in gynecologic oncology and breast cancer, as well as a registered dietitian. We'll discuss risk reductions, strategies for pre and postmenopausal women, recommended screenings, the latest cancer research, and food choices for better health. Well, thank you so much for submitting your questions in advance. The questions that you'll hear me asking the providers are all submitted right from when you registered for this webinar. And if you have any questions throughout our discussion tonight, for those joining us on your computer or tablet, at, excuse me, at the bottom of your screen, you'll see an icon that says Q&A. We'll do our very best to get to as many questions as possible, but may not be able to answer all of them during tonight's virtual event. And due to hospital guidelines and privacy, we are unable to comment on specific cases. Well, with that, I want to go ahead and introduce our experts for the evening. Our experts include Natalie Darcy, a registered dietitian, Dr. Nick Cardillo, gynecologic oncology, and Dr. Steve Monobianco, medical oncology. Well, thank you all for joining us this evening. Before we dive into the questions, which I know we received a lot and we'll have definitely an interesting discussion tonight, I want to give each of you a minute or two to just say hello and provide a little bit of background information about yourself. So Natalie, we'll go ahead and start with you.
Hi, good evening, everyone. I'm Natalie Darcy, registered and licensed dietitian. I've worked in oncology for over 11 years. I've been here at Asplund Cancer Pavilion since we opened up in July of 2017. And prior to that, I worked at Rosenfeld Cancer Center at Abington. My primary job here at Asplund is to help patients get through treatment. So to help them get through some of the side effects that they're having, helping them to reach their protein needs and keep up their strength so that their treatments do not get canceled. I also work in survivorship with patients and for preventative events like healthcare events that we have here at Asplund.
Okay, well, thank you. We're thrilled to have you. Okay,
Thank you.
Dr. Cardillo.
Hi, thank you, Sarah. I am Nick Cardillo. I'm a board-certified GYN oncologist, specializing in cancers of the gynecologic tract, such as ovarian cancer, uterine cancer, cervical cancer. I am a surgeon, so I operate on these cancers, and I also administer the chemotherapy and treatment afterwards. I'm based in Jefferson Abington Hospital, Asplund Cancer Pavilion, and Jefferson Torresdale.
Okay, all right, well, welcome. Okay, and last but not least, Dr. Monobianco.
Good evening, everyone. I'm Dr. Steve Monobianco. I am a medical oncologist here at the Sidney Kimmel Cancer Center, and I practice in the Honickman Center here in Center City. I'm also a certified cancer genetic risk assessment provider. My practice is focused on breast care, the medical management of breast cancer. I also see men and women with hereditary cancer syndromes like BRCA1 and 2 mutations, as well as individuals with high familial risks of cancer, looking for ways to enhance their screening for cancer or take medications to prevent cancer if at all possible.
Okay, well, welcome and thank you all. Let's not wait any longer and dive into the questions. So the first question we have for tonight, Dr. Monobianco, I will direct this one to you. How does hormone therapy impact the risk of breast cancer?
That's a great question, and it's one that I get quite a lot. It's important to know that when we think about the types of breast cancer that women may get, about 70% or about 3/4 of those are what we call hormone positive breast cancer, which is breast cancer that has likely grown due to exposure to estrogen or progesterone, which are female hormones that are naturally elevated in the body, especially in younger premenopausal women. And there's been a number of studies looking at the risks of breast cancer specifically with hormone replacement. Probably the best data that we have comes from something called the Women's Health Initiative. This was arguably the largest study on women's health in the history of the United States, looking at tens of thousands of women. And they looked at women who took hormone replacement therapy, whether that was with estrogen and progesterone, what we call combined hormones, or estrogen alone. And they compared the risk of breast cancer over the course of those women's lives. And what they found was that women who took estrogen and progesterone together had a small increased risk of breast cancer. They measured this in something called person years, which says that in all the years that all these women were alive, how many extra cases of breast cancer did they find? And in women who took those combined hormones, the extra cancers that they attributed to this was about 8 per 10,000 person years, which is to say that though there was an increased risk, that risk was pretty small overall. Most women did not go on to develop breast cancer. It's also really interesting that estrogen alone, which some women took on that trial, has other side effects that are maybe not positive for women, but was maybe slightly protective against breast cancer. There's also been more studies that have been coming out look at the risk of breast cancer with oral contraceptive, so hormone to prevent pregnancy, and IUDs, with one study published maybe about 8 months ago, showing a small increased risk with a progesterone IUD in place. So not estrogen at all, but just that female hormone progesterone. Again, the risk was small. The excess rate was probably similar to what they saw in the women's health study. But I think it's important when women are considering the risks and benefits. I should also add that there are plenty of benefits besides breast cancer risk to really think about when a woman is considering taking hormone replacement. And there may be many good reasons for a woman to consider that. One thing that I know I offer, and I'm sure my colleagues here on this panel offer, is really insight into that risk and benefit discussion, understanding the symptoms or lifestyle factors that may have led to that woman taking hormone replacement, and weighing that against her individual risk of breast cancer over the course of either short-term time periods or really her life. So it's a very good question. It's one that I think we'll continue to learn about as we think about the long-term effects. But I think the takeaway is there may be a small absolute risk increase, but there can be very good reasons to be on these medicines outside of thinking about breast cancer.
Okay. All right. Thank you. And thanks for walking us through that study. That was really helpful.
Of course.
All right. Dr. Cardillo, we will turn to you now. Let's talk a little bit about genetic testing. So how can someone get genetic testing or screenings, and is it recommended for someone who has had family members who have had cancer?
So there are a number of ways to obtain genetic testing. Most of them are going to be through some sort of provider, so either a physician, a nurse practitioner, or a clinical geneticist. You can be referred to these providers by your primary care physician, depending on your history, your personal history, and your family history. So women in particular who have certain types of cancer will be recommended to get genetic testing. Specifically, any woman with ovarian cancer, any woman with certain types of endometrial cancer with certain mutations within them, women with breast cancer, triple negative breast cancer below age 50. There are a number of different criteria for different cancers and different family histories. And your primary care physician or your gynecologist or one of us, if you were to happen to see us, could help you work through those and see whether or not you qualify for genetic testing. If you do qualify for genetic testing, I would recommend that you meet with a clinical geneticist. We have several of them here in the Jefferson system, so that they can counsel you on the benefits of undergoing genetic testing, whether or not you qualify for genetic testing, what the costs associated would be. If you do qualify, most insurances will cover it, but each insurance is different to what extent. And then you'll undergo testing, which can either be a blood test or a cheek swab. And then when the results return, the clinical geneticist will contact you again, usually through a telehealth visit, and discuss those results and those implications for your own health as well as your family's health. There are some providers, such as myself, who do send some of this testing directly from our office. because I feel comfortable counseling patients on those results. But outside of that, outside of having a provider who is comfortable with that, you should see a clinical geneticist.
Okay. And can you tell us a little bit about the accuracy of these genetic cancer screenings?
Yes, so the accuracy of these tests is very high. So the accuracy of the test we use most commonly is about 99.99% accurate for identifying mutations in the certain genes that they test in their panel. So if you have a test done, you can trust the results. However, I will caution that a little bit because we are always learning something new about genetics. So it is possible that sometime in the future, we may learn that other genes that are currently not being tested for may be clinically significant. So especially for patients with family members who received testing several years ago, or people who had their own testing several years ago, it may be worth it to look into repeat testing with updated panels.
Okay. All right. That's good to know. Thank you. All right. Natalie, we will turn to you now, talking a little bit about diet. So, what should we be restricting or limiting in our diets to help reduce cancer? And are there certain foods that would help prevent colon cancer?
So in general, foods to restrict would be things like fast food, red meat, processed meats, sugar sweetened beverages, and alcohol. As far as just preventing colon cancer with the focus on colon cancer, the colon's direct contact with food and carcinogens accounts for a strong association with nutrition and lifestyle. So as you increase your intake of alcohol, you also increase your risk of colon cancer. We also want food to move quickly through the colon, so a high fiber diet is protective, will decrease your risk. So lots of fruits and vegetables, whole grains, legumes, lentils. Activity is very important in preventing colon cancer. So being active, daily exercise is very important. A low serum vitamin D is linked to colon cancer, so having your vitamin D level checked is important. And low calcium intake has been linked to colon cancer.
Okay. All right. Thank you. And on top of that, are there any other cancer fighting foods that you would want to let people know about tonight?
So there are foods under the fancy title of phytochemicals. So phytochemicals are compounds with health protecting qualities. So one of those types of foods are going to be your fruits and vegetables, your cruciferous vegetables like broccoli and cauliflower and kale. It's also going to be your phytoestrogens, which is soy and flaxseed and beans and legumes. All of those foods have anti-inflammatory effects and prevent cancer.
Okay. All right. Thank you. Anything else you'd like to add?
Things to remember too are also garlic and onions, leeks and shallots. All of these foods are going to be have cancer fighting properties.
Okay. Great. Thank you. And this is very helpful to keep in mind. Okay. Dr. Mano Bianco, we will turn to you now. Let's go back to talking about breast cancer here. If all the breast cancer is on the paternal side of the family, are you at great, moderate, or low risk?
A great question. When we look at breast cancer risk, we really take into account the entire family. So I would say that having a family member on one side versus another is not necessarily in itself a good or bad thing. Though, of course, if we see cancers cluster around one side, so in this example, dad's side, that does maybe raise the question of there being a genetic syndrome or mutation in that family that increases the risk for some type of cancer, maybe breast cancer or something else that comes from that side. When we think about who to test based on family history, we actually use those factors to determine who the best person is. So perhaps for this patient, if he or she does not have cancer, but maybe let's say their father does, and their paternal grandmother or grandfather do, maybe dad would be the best person to test to clarify your own risk. It's important to know that when we think about risks of most cancer genes, these are inherited one copy from mom and one copy from dad. So having a family member that happens to have a copy of a gene that increases the risk of breast cancer does not necessarily guarantee that any one person is going to inherit those genes. And when you sit down with a certified genetic counselor or someone like myself, we would talk about that at length to really understand how to value a positive or negative test in the context of your own cancer risk. And as I said, who might be a good additional family member to test. And as Dr. Cardillo mentioned, if someone is going to pursue genetic testing, we use all the cancers that may or may not be in that person's family to design the list of genes that we would consider testing. It's actually quite uncommon in 2025 for us to recommend a single gene to be tested, unless we know there's one gene in that person's family that we have documented evidence of, and that person does not want to explore other mutations. These gene panels can be as small as a small handful of genes and can go into the tens, whether that's over 50, 75, or sometimes over 100 genes. Although, as already mentioned, we don't test every gene in a person's body. So it's really something that is individualized for every person that comes into our office.
Okay. All right. As a follow-up to that, I'm going to give you a situation here. What makes sense for a woman who's in her early 40s, whose mother had breast cancer in her early 60s? What should this woman do for prevention and early detection?
So that's a great question. And I would say that I would ask first for a little bit more information. There are certain features, as already mentioned, in someone's breast cancer diagnosis that maybe increases our suspicion of a cancer syndrome. For example, we know that women of Ashkenazi Jewish heritage have much higher rates of BRCA1 or 2 mutations than the general population. The average American woman's risk or incidence is about 1 in 400. And in the Ashkenazi Jewish population, that rate of mutations is nearly 1 in 40. So if I find out that a woman has a family history of breast cancer with that heritage, I would consider genetic testing. We also know that types of breast cancer like triple negative breast cancer, which is a very unique aggressive type, more common with certain mutations, having multiple breast cancers at the same time, or a very early breast cancer diagnosis, especially before the age of 50 years old, increase my suspicion and are good reasons to consider genetic testing. But let's take the hypothetical that this particular woman's mother does not meet those criteria, and she wants to better understand her own risk. She could certainly pursue genetic testing, which, if not covered by insurance, is generally a relatively small fee out of pocket. I wouldn't want to give any guarantees, but I will say that most testing companies have capped cost somewhere between $100 and $250 for women who don't qualify in an effort to make that more accessible. Let's say that either they don't pursue testing or that testing's negative. Then they would meet with someone like myself who would run risk models to understand their risk of breast cancer. And these take into account a number of things that we know are related to the risk of breast cancer. Things like how young a woman was when she started having periods, how many pregnancies she had or deliveries, what family members may or may not have had cancer, and even things like height and weight, which may have some small risk adjustment to that woman's risk. We would calculate that risk, and based on either her 5 or 10-year risk of breast cancer or lifetime risk, we can consider options including enhanced screening with MRI in addition to mammograms, or the use of a preventative hormone medication like tamoxifen or exemestane that would lower that woman's risk of cancer by somewhere between 40 and 60%, depending on the woman, her individual risk, and the other factors at play. So what I would say is that's a very complicated question. And I would hope that that woman would somehow find her way into my clinic so we could explore that in detail.
All right. Yeah, it seems like there's some options. So thank you for walking us through that. All right. Before I go to the next question here, just a friendly reminder, if you have any questions that are popping up for you during this discussion, feel free to drop them in the chat and we'll get to them at the end of our submitted questions. Okay, so moving along here, Natalie, we will go back to you for a moment. Does the same nutrition advice that you talked to earlier for breast cancer prevention, would that also pertain to breast cancer recurrence?
It actually would. So the simple answer is yes. In general, the recommendations are to maintain a healthy weight, to become active, activity every day, eat plenty of fruits and vegetables, choose your carbs wisely, focus on healthy fats, and select your beverages carefully. There's a little bit more detailed list put out by the American Cancer Society, and they have over 12 recommendations. And what they've been able to show is that by following these guidelines, you can decrease your risk of breast cancer by 22%. And for reoccurrence, you can decrease your risk by 33%, which is really impressive. And just to go through a couple of the recommendations, one is a low-fat diet, so low in saturated fat, getting your fats from healthy sources like avocado and olive oil and fatty fish, increasing fruits and vegetables to the point where your fiber is at least 25 to 30 grams a day, increasing your flaxseed to 1 to 3 tablespoons a day, soy 2 to 3 servings. So a serving of soy would be a half a cup of miso, 3 ounces of tempeh. So these are whole sources of soy. A cup of soy milk, dairy 2 servings a day, keeping it to a lower fat source. So lower fat yogurt, maybe 2% or 1% milk. Exercise 30 minutes 6 times a week, which is a lot for some people. The general recommendation is 150 minutes of exercise a week and 2 days of strength training for 20 minutes. So the general recommendation is 150. The ACS, the American Cancer Society, is saying 30 for 6 times a week. Red meat, you can have up to 3 times a week. So that's 11 to 18 ounces for breast cancer. For somebody who's decreasing the risk or reoccurrence. Fasting, what's been shown to really help is 13 hours of fasting. So that would be, your last meal at 7, being done at 7 and not eating again to 8. So it's an overnight fast. This is not recommended for somebody going through treatment that's struggling, but this is for somebody who's, able to eat and not struggling in that way. A weight between, for a BMI between 18.5 to 25, calcium intake of 1,200 milligrams, vitamin D to get your vitamin D level checked to see if it's within normal limits, and if not, to supplement. And alcohol, this is going back and forth. At one point, it was women can have 1 serving a day, men 2. And then it changed to less is best. And I think that's kind of where we are now. But the recommendations for the American Cancer Society, they say 3 to 4 a week. And that's it.
Okay.
It's a lot.
A lot to keep in mind. Thank you. All right. Let's go back to Dr. Monabianco for a moment. If someone has undergone treatment for triple negative breast cancer, what can they do to lessen their chances of recurrence, if there is anything?
A really good question. Triple negative breast cancer, for just everybody's education, makes up somewhere in the range of 10 to 15% of breast cancers. This is not a breast cancer that seems to grow due to the exposure of hormones. And it also doesn't seem to rely on something called HER2, which make up the 3 things that we talk about when we say triple negative, negative for all 3 under the microscope. This is a type of cancer that is often treated aggressively with chemotherapy and maybe even immune therapy, a drug that would raise your own immune system to fight the cancer. Many of the things that Natalie has already mentioned certainly apply to these women as well. And I will say that the role of hormones or the use of hormone replacement in these women and their risk of breast cancer is a little bit of an open question in medicine. Because as I mentioned, this cancer probably didn't grow due to the presence of estrogen or progesterone. So I think that all of the healthy lifestyle changes, dietary modifications, exercise, lowering alcohol intake, these are all things to reduce a woman's overall risk of breast cancer, and I would argue probably her risk of triple negative breast cancer too. Ultimately, I certainly recommend close follow-up with your medical oncology and breast surgery teams. Women who have triple negative breast cancer often see me or my team at least once every 3 months for the first 2 years after their diagnosis. We do a clinical chest exam and breast exam. If they did not get a bilateral mastectomy, we also do imaging to look for any signs of that cancer coming back. And we slowly space out those visits to about once every 6 months for the next 3 years. We are even very lucky in collaboration with our breast surgery team to have what we call our long-term survivorship clinic, where women that are alive and cancer-free for 5 or more years follow up with a physician, nurse practitioner, or physician assistant at least once a year to review imaging, perform a clinical chest or breast exam, and make sure that many of those healthy lifestyle things are reinforced. So I think there's a lot of things that women can do to help lower their chance of a triple negative breast cancer coming back.
Okay. Thank you so much. All right, Natalie, we will turn back to you now. Talking a little bit here about any nutrition or lifestyle tips for premenopausal women starting tamoxifen.
So tamoxifen blocks the effects of estrogen in the breast tissue. And like any medication, it has side effects. It's a very important medication, but it does have side effects. And some of these are hot flashes and night sweats, fatigue, dizziness, could be weight gain, fluid retention, and more serious ones like blood clots. That's just to name a few. Many patients are not fixated, but they think about the weight gain. And I've seen patients not want to take it because of that. But it doesn't necessarily cause weight gain in everybody. So I think to prepare for that, I would make sure that you find an activity that you enjoy and do it as often as you can. Now, one of the side effects of tamoxifen is fatigue, and that makes you not want to exercise. But believe it or not, exercising helps with fatigue. Doesn't sound like it makes sense, but it truly does. And so movement is going to be very important. All the same dietary restrictions are the same as far as eating less fat, fast foods, drinking less sugary beverages, eating more fruits and vegetables and whole grains. All of that stands true for this particular patient. But exercise is going to be important. Staying on the medication is going to be really important. I do know that some patients can't because of the side effects. The other thing I wanted to bring up, because I do hear it from my patients, is that sometimes the side effect of feeling fatigue and losing interest and being tired makes it really hard to do all the things that I've talked about tonight. And I would say to somebody going through this that's on tamoxifen, don't beat yourself up. If you can do even just a little bit, it's going to make a difference. So just a 10-minute walk, trying to eat some vegetables. We beat up highly processed foods and it has really a bad connotation with it. Maybe minimally processed foods. Maybe instead of chopping up vegetables when you're tired, just frozen vegetables. If you want fruit and you don't feel like going through the task of cutting it up or preparing it, maybe, a little fruit bowl that's packaged in water, minimally processed foods that you can add to your meal plan so that you are nourishing yourself. So I think it's important to realize that the side effects are real and, some of the side effects are lingering from the treatment that you've gone through. And so it's not easy to follow these recommendations.
Yeah, absolutely. Thank you for bringing that up. A reminder to be kind to yourself.
Yes.
Okay, well, thank you. I have one more follow-up question for you. And that is if you have any other nutrition, lifestyle advice for women who are in perimenopause and menopause.
So The difference between the two is going to be, hormonal changes and things like that. And one of the things with menopause that puts those women at risk is osteoporosis and heart disease. But like all of the recommendations nutritionally, they're really going to stand the same because you really do, want to be exercising for multiple reasons. And one of them is to avoid, if you have osteopenia, to strengthen your bones. If you're perimenopausal, it's to increase your metabolism and strengthen your muscles. And if you've gone through menopause, you're losing muscle at a faster rate. So exercise is really important, and just eating healthy, lots of fruits and vegetables. Vegetables are your friend. They are high in fiber, they have cancer-fighting properties, and they don't have a lot of calories. So if you can eat lots of vegetables, sticking to a plant-based diet, that's not saying to become a vegan, but to bring in lots of fruits and vegetables and whole grains to your diet.
All right, thank you. Okay, Dr. Cardillo, we will go to you now. Can you talk a little bit about the role of exercise in reducing recurrence for patients with a genetic mutation?
Yes. So I think we can look at the role of exercise in terms of your outcome from cancer, your recurrence risk for cancer, in sort of several different sections. So we know that patients who exercise regularly with at least moderate intensity, so something a little bit more than walking, exercising 3 to 4 times per week for at least 30 minutes at a time, do have a reduced risk of developing cancer in the first place. We also know that patients who regularly exercise, especially around the time of potentially their surgery for cancer, do have improved outcomes from that perspective as well, not just from recovery from surgery, but faster time to, not faster time, but more likely to be on time getting to treatment, and also do tend to have better outcomes. In terms of patients who have already had cancer and looking at their recurrence risk, there does seem to be an association, again, between moderate intensity exercise on a regular basis for 3 to 4 days a week, 30 to 45 minutes with each session, obtaining somewhere between 60 and 80% of your maximum heart rate, with reducing the risk of recurrence. However, that reduction is not as strong as the reduction in your risk of developing cancer in the first place for someone who is exercising. Now, it is difficult to perform these studies, but there have been several randomized trials looking at this, and that's essentially what they found, that exercising in the first place certainly does reduce your risk of getting cancer. The risk of recurrence is also probably somewhat reduced with regular exercise, but the association is not quite as strong as it is for preventing it in the first place.
Okay.
I will say one more thing about exercise. If you are fit, if you are regularly exercising, you tend to tolerate the treatment you sometimes need for your cancer better. Your body is a little bit more resilient. It can take a little bit more in terms of the side effects that your treatment is causing. And you have a little bit more reserve to draw from to get through your treatment.
Okay. All right. That's helpful to know, and a reminder to go out and exercise. So thank you. Okay. For our last question before we turn to live questions from the audience, and I know you have been submitting a ton, so thank you. Natalie, this question is for you. And a question I've heard before, so I'm curious. Does sugar consumption cause cancer or cause cancer cells to spread?
Although research has shown that cancer cells consume more sugar than normal cells, no studies have shown that eating sugar will make your cancer worse, or if you stop eating sugar, your cancer will shrink or disappear. However, a high sugar diet can contribute to excess weight, and obesity is associated with an increased risk of developing several types of cancers. So, it's not good to eat things with added sugar, though it's not going to make your cancer worse. So, a couple recommendations. I mean, things that have a lot of added sugar. And so when you're looking at a label, I really want people to look at added sugar. We're not looking at the sugar that's in fresh fruit or in vegetables. We're looking at added sugar. So added sugar that's in sweetened beverages. So your soft drinks, your fruit drinks, your sports and energy drinks, desserts and sweet snacks, your coffee from Starbucks, that has sugar in it, candy, breakfast cereals and bars, sweetened yogurt, flavored milk, those kind of things have added sugar. The American Heart Association has recommendations, and one of them for women is 6 teaspoons of sugar a day. So what does that mean? So each teaspoon of sugar is 4 grams. So it's about 24 grams of sugar a day. Now, the government guidelines for Americans are higher. It's at 12 teaspoons, but I tend to use the American Heart Association's recommendation. And so that's 25 grams of sugar a day. So if you drink a soda and you look at the sugar content, you're going to be really upset because it's probably around 36 grams. Keep in mind, again, as far as fruits versus added sugar, if you look up the amount of sugar that's in, let's say, an apple versus the amount of sugar in a drink, it's going to make a difference for several reasons. And one of them, which is very simple, is the fiber that's in the apple. So that sugar is not going to be digested immediately and enter into the bloodstream. It's going to do it much slower. So when you hear, not to eat things like don't eat carrots, they have sugar in them. I mean, really be cautious about that. It's really about the added sugar that's in foods and not the natural sugar that's in fruits and vegetables.
Okay. All right. Thank you. I think that's an important call out for people to keep in mind. So thank you. Okay, well, with that, I know we've been receiving some live questions here, so I want to dive into them. So how it's going to work, I'm just going to ask the question. Whoever wants to chime in, feel free. This can definitely be an open discussion. But yeah, and to our audience, feel free to continue submitting questions. We will get to them throughout the rest of our time this evening. All right, so to start us off with, this first question here, Natalie, this one actually might be for you. This person says, I quit drinking alcohol last year and am concerned about the excess estrogen my body has been maybe holding on to and now has detoxed since quitting. Could this contribute to a greater risk? Is this possible?
So just so I'm clear, she said she stopped drinking alcohol. She's not drinking alcohol anymore. And she's wondering if this could be more dangerous for maybe her risk of reoccurrence or breast cancer. Is that, or is it just any cancer? Or she didn't mention breast cancer.
Yeah, just concerned about the excess estrogen that my body has been maybe holding on to and now has detoxed since quitting may contribute to greater risk.
So I would say, not drinking alcohol is really the way to go, as far as preventing many cancers. And just to name a few, one of them is breast cancer, colon cancer, esophageal cancer, head and neck cancer, and there's pancreatic cancer, gastric cancer. So it's much better to completely eliminate alcohol if you can. I mean, that's really the way to go. As far as holding on to estrogen and things like that, I don't know if the doctors can chime in on that. But one thing I do want to talk a little bit about is there's a lot of information out about, certain vegetables that have, estrogen properties in them. And I would say, don't listen to that talk on the internet about avoiding vegetables because they have too much estrogen in them. It's not true. plant estrogen or phytoestrogens are different from human estrogen, and that you shouldn't restrict any vegetables because of that. I don't know if one of the doctors wants to chime in about your estrogen levels going up when you stop drinking alcohol. I'm not aware of that.
I'm not either. And I will say that first of all, I would just like to commend the person who asked this question for quitting drinking. We've known, as it's been mentioned, for a very long time that alcohol consumption probably increases the risk of breast cancer due to estrogen metabolism within the liver. And women who are heavy users of alcohol certainly have a documented higher risk of both developing breast cancer and recurrence. I will also say that people who drink heavily often have more adipose or fat tissue. And we know that, especially in postmenopausal women, that is a major source of estrogen after going through menopause. And it
Right.
probably answers a question that I think I see a little bit lower. I do not routinely check hormone levels to determine someone's cancer risk. I think that we understand pretty well, especially from breast cancer, that it is not so much any exact exposure to estrogen at one time. It's probably the lifetime accumulation of breast cancer, of estrogen over the course of that woman's life that results in that increased risk of breast cancer.
Okay, thank you. And yes, Dr. Cordell, anything to add?
I was just going to say, I think Dr. Monabianco touched on what she may have been referring to in terms of estrogen metabolism in the liver in patients who are drinking. And so I think perhaps that's what she was talking about. Does that affect her future risk of breast cancer because she may have been drinking for some time and having some elevated estrogen levels during that time? That's my interpretation. That's all.
Hmm.
Okay, thank you. And yes, a kudos for stopping drinking. All right, next question here. I was advised by my oncologist to not take HRT because I had a history of ovarian cancer. Is a new study available and updated for the use of HRT in patients with a history of ovarian cancer?
So in terms of ovarian cancer, there are several different types. Some of them are estrogen sensitive and some of them are not. The most common, which is called high-grade serous carcinoma, is generally estrogen receptor positive. And so in those cases, we generally recommend that patients do not take estrogen for hormone replacement therapy after such a diagnosis. Um, the reason for that is we do not want to encourage any type of recurrence or speed that up. I do not think there are any ovarian cancer studies looking at the potential for hormone replacement after diagnosis.
Okay. All right, thank you. Okay, next question here. What is the average woman's overall cancer risk if there is no family history?
Um, I'm going to just answer for breast cancer because that is the most common non-skin cancer that women get in the United States. In 2024, we estimate there were about 310,000 new cases of breast cancer in the US. And the average woman's risk across the United States in her lifetime is 12.5%, which means that unfortunately 1 in 8 women in America will be diagnosed with breast cancer in their lifetime.
Hmm.
And other factors may change that risk, as we've talked about today.
All right, thank you. Okay, next question here. If you test positive for a gene that increases breast cancer risk, is it necessary to have a mastectomy?
I suppose I'll take that one too. I would say that it is very dependent. Every gene has an individual risk of breast cancer. For example, there are genes like BRCA1 where the risk of breast cancer in a woman's lifetime exceeds 60%. Very high. Those women, as standard of care, are generally offered bilateral risk-reducing mastectomy versus enhanced screening with MRIs and frequent exams. There are other genes that are associated with breast cancer that only provide a small risk increase. think on the order of 20 to 25%. For those women, doing what is a very large surgery that we know affects intimacy, self-image, mental health, can have complications in and of itself, is generally considered quite extreme and not the standard of care. So what I would say is that it requires a real risk-benefit discussion with someone who is a cancer geneticist or cancer genetic risk assessment provider and a breast surgeon who specializes in preventative surgery for breast cancer.
Okay. Thank you. All right. And while I have you, Dr. Monabianco, this next question here might also be for you. This person is wondering, can a cyst grow into breast cancer, and how long does this typically take to happen?
It's a very good question. I would say that it really depends. Generally speaking, based on either imaging or biopsy, a pathologist, so someone who specializes at looking at tissue under the microscope, can tell us whether or not something is benign, which means non-cancerous, cancer, or what I would call a high-risk lesion. So there can be changes in the breast, things such as, just to name some, atypical ductal hyperplasia or ADH, or lobular carcinoma in situ, LCIS, that are not in and of themselves breast cancer, but we know increase the risk of breast cancer over a woman's lifetime, some of these exceeding 20%. And that woman should be managed in collaboration with a medical oncologist like myself and a breast surgeon to determine the best way to manage that woman's risk, whether that's through surgery or a hormone blocking medicine like tamoxifen to lower her risk. So I would say it really depends on what we see under the microscope, and that individualized plan comes weighing the risks and benefits of different strategies.
Okay. You brought up tamoxifen, and this next question is a good follow-up here. Will medications such as tamoxifen lead to early menopause symptoms?
Good question. Those are common side effects of these medications because we're disrupting estrogen. Tamoxifen itself does not necessarily lower estrogen in the body. It changes the way that the breast senses that estrogen. I think about breast cancer cells and estrogen like a lock and a key. And the simplest way to think about it is tamoxifen is kind of like sticking gum in the lock. That key can't quite fit in there, and that breast cancer cell or breast can't grow in response. The most common side effects of this really are ones of menopause, though this can be more tolerable than some of our other medications, such as exemestane or drugs known as aromatase inhibitors that tend to cause more symptoms of menopause. But things like hot flashes, muscular joint aches, and vaginal dryness can certainly be seen with tamoxifen. One of the privileges I have as a breast oncologist is knowing women over the course of their treatment for 5, 10 plus years. And we have really good ways of managing this, whether it is through things like dietary changes. Sometimes things like acupuncture or exercise have really good data for managing the symptoms on tamoxifen. And sometimes we do have to use other supporting medicines to help things like hot flashes. But generally, we can guide women through that journey. And we've done that for, gosh, thousands of women really every year.
Okay. All right. Thank you.
Sure.
Okay. Next question here. What is a general recommendation for genetic testing for women adopted as an infant in a closed adoption with no information on family health history?
I can take that one. So for a woman with no known family history, genetic testing would mostly be driven by your own medical history. So if you do develop a cancer of your own, then if you qualify for genetic testing based on that type of cancer, then you'd be recommended for it. If you were looking for information prior to a diagnosis of your own, it's certainly something that you can discuss with your primary care physician or one of us or a cancer geneticist. And they would walk you through the process of testing. What would the costs be? What would be the pros and cons? And you could consider, pursuing it on your own. It may not be covered by insurance, but as Dr. Monabianco had mentioned earlier, there are typically caps for the amount that these companies will charge for testing, and they are generally somewhat reasonable. So if you were interested and you wanted to pursue it, you certainly could.
Okay. All right. Thank you. Okay, next question here. I have been told that soy exacerbates fibroids. How should one proceed if attempting to prevent cancer and the return of fibroids that have been removed?
I'll take that one too. So in terms of soy exacerbating fibroids can be hormonally sensitive. That's why they sometimes grow as you are approaching menopause. However, as Natalie had mentioned earlier, phytoestrogens, which are the types of estrogens that are found in vegetables, or in this case, soy, generally act differently on the body than your natural estrogens that you create on your own. As a result, I would not say that you need to avoid soy in order to avoid recurrence of your fibroids. Your fibroids may recur, but it almost certainly would not have anything to do with soy in your diet.
All right, thank you. Okay, next question here. Can certain blood types be a factor for breast cancer? And I see you thinking.
Off the top of my head, I'm not sure. So I wouldn't want to speak out of turn. That's a very interesting question. My suspicion is that if there is an impact, it's probably small. And most likely, the risk factors we've talked about today at length probably represent bigger impacts when considering a woman's overall risk from a large standpoint. But truthfully, I'm not too sure.
All right. Okay, we'll get to, let's see, two more questions, and then we're going to hop to our final question for this evening as we wrap up. A quick question here. Does dense breast tissue increase the chance of getting breast cancer?
I can probably answer that too. Dense breast tissue is a small risk increase for breast cancer. It is one of many risks. And when we think about a woman's overall risk, I think it's something that has to be taken into account. I will say that in the United States, it is standard in, I believe, all 50 states to report a woman's breast density on mammograms, and we grade them from A to D. A being none or very little, all the way to D, which would be extremely dense breasts. And in women with that kind of grade C or D breast density, it is standard to add ultrasounds to help increase the diagnostic accuracy of a mammogram, which we know goes down slightly in women with more dense breasts. That's not preventative of breast cancer, of course. We're just looking a little bit harder. But it is an extra tool that helps us understand a woman who may be harder to read on a standard mammogram.
All right. Well, thank you. With that, knowing that we have about 5 minutes left, I will turn to our last question for the evening, which is my own question for you all, and then we will wrap up. So for this last question, what are your goals for everyone listening in on this webinar, and what would you like our viewers to take away from tonight? Dr. Cardillo, we'll go ahead and start with you.
Okay, so I think because this webinar is focused mostly on nutrition and exercise, I do think that the major message to get across is having a healthy diet full of full fruits and vegetables, including the fiber that comes with them, whole grains, as little added sugar as possible, is going to be beneficial for your cancer risk and your risk of recurrence. Exercise is the same thing. We don't know exactly which exercises you should be doing that are going to be better than others, but we do know that at least moderate intensity, 3 to 4 days a week for at least 30 minutes is going to be beneficial for you. It's going to benefit you in many, many different ways, not just in your cancer risk, but in the rest of your life. And so I think that's the major take-home point from this. Additionally, if you have questions about your family history or about yourself or about things that you can do to reduce your risk of certain types of cancer, feel free to reach out to your primary care provider or one of us. I see patients all the time to talk about family history of ovarian cancer or their ways to reduce risk of future cancer development. Always happy to see patients. So, do not be afraid to ask. Do not be afraid to reach out. That's what we're here for.
Absolutely. Okay. Well, thank you. All right, Dr. Monabianco, we will turn to you.
Great. I would say that if I had a takeaway here, it's that knowledge is power, and you did the best thing for your health by taking a step to sit on a webinar on a Wednesday night and listen to us talk about your cancer risk. I see women every day and men who are scared. They're scared of the information that we uncover. They're scared because we may be talking about a change in their lives in a major way. That could be surgery or medications that affect their quality of life. And I always tell people that you are the person you have always been. And when we do things like risk assessment, genetic testing, or lifestyle interventions, we're putting power back in your hands to make the best decisions in your best interests in accordance with your values. So I think don't shy away from this information. Share it with your family, have those difficult conversations, understand the lore of your family and maybe the history behind people's cancer or their own journeys, and use that to help make decisions to better your own health.
All right. Thank you so much. And Natalie, last but not least.
So I just have three takeaways, and as you can tell from my answers, that exercise is so important. And I would say if you struggle to get going, keep in mind that there's a program called Live Strong at the YMCA. It's available for people that have gone through cancer treatment. It's a 12-week program. You meet twice a week, and you'll have other people that have gone through the same thing you have. It's a great program, and it's free. So that's the Live Strong program. Two would be, getting in those fruits and vegetables, at least 2 fruits, 5 vegetables. It sounds overwhelming. Just start out slow, try to do what you can and build on it. But, fruits and vegetables have those cancer fighting properties. They have fiber, which is going to really help you to keep your weight at a good level and to make you feel good. And then the last thing is just, trying really hard to get rid of those, added sugary beverages, and limiting your alcohol. I know it's hard. Alcohol's, seen in holidays and festivals, but believe me, you could still have fun and still participate without drinking. So thank you.
Thank you. Thank you all so much, Dr. Cardillo, Dr. Monabianco, and Natalie, for your time this evening, for those closing remarks. We really appreciate you taking the time and for such great information that was shared. I know I learned a ton, and thank you all for attending. Like Dr. Monabianco said, taking the time to attend on a Wednesday night, and submitting your questions. We will be posting an event survey, so you can let us know your thoughts, any other specialties that you would like to hear from. If you would like someone to contact you directly to schedule an appointment with a Jefferson Health provider, you can go ahead and fill out the last question in the event survey. Be sure to visit jeffersonhealth.org to make an appointment, stay up to date on upcoming events and webinars like this one and more. You can also visit jeffersonhealth.org/livingwell for more health content, patient stories, research, and innovation. Be sure to check out the Jefferson Health YouTube page where you can view more wellness webinar series events. We have various topics from back pain to robotic surgery to hearing loss, men's and women's health topics, and a lot more. So go check it out. A recording of this event will also be sent to you so you can rewatch. If there's anything anyone here at Jefferson can do for you, please reach out to us. Thank you once again for joining, and please be sure to stay safe and healthy. Have a wonderful evening and good night.